Hi, this is Dr. Otto Janke for the Empire Longevity Podcast. If you had an opportunity to decrease, possibly reverse cancers, would you do it? How about cardiovascular disease, coronary artery disease? Would you be interested in that? How about decreasing or reversing Alzheimer's? Now I've got your attention, don't I? You've heard me talk about these studies before. But back in, it's published in the Journal of the American Medical Association. The title is Intensive Lifestyle Changes for Reversal of Coronary Heart Disease. #1 killer of Americans by far, and has been for decades. Our healthcare system has failed dramatically. Let's be honest about this. Our healthcare system has failed dramatically at reversing this course. We have more and more Americans on more and more medications to combat high cholesterols, cardiovascular disease, cleaning the blood, doing many things. And we still have people dropping dead left and right from heart attacks and strokes. Intensive lifestyle changes for reversal of coronary heart disease. Journal of the American Medical Association. Very simply, the lifestyle heart trial demonstrated that intensive lifestyle changes may lead to regression of coronary atherosclerosis after 1 year. They did this actually did a follow-up 5 years, and it was actually even better, as you thought it might be. The objective of this was to determine the feasibility of patients to sustain intensive lifestyle changes for a total of 5 years and the effects these lifestyle changes without lipid-lowering drugs, without the statins, on coronary heart disease. The randomized controlled trial conducted from 1986 to 1992 used a randomized invitational design. 48 patients with moderate to severe coronary heart disease were randomized to an intensive lifestyle change group or to a usual care group, and 35 completed the 5-year follow-up quantitative coronary arteriography. Main outcome measures: adherence to intensive lifestyle changes and changes in coronary artery percent diameter stenosis. Understand what these people did is that how much more devastating could a heart attack or stroke be? That's a pretty dramatic, intensive lifestyle change when you have a heart attack or stroke. And now they're saying if you do these other things, you can reverse it and not have the heart attack or stroke. You look at this thing, you have to do this really hard stuff. If you do this really hard stuff, it's guys, are you kidding me? Intensive lifestyle changes. So 10% of fat, whole foods, vegetarian diet. You go to a vegetarian diet where 10% of the foods you're going to eat are 10% of it's going to be fat. You do aerobic exercise, stress management training, don't smoke, and go group psychosocial support. So let's break this down. They went to a vegetarian diet. And you're like, that's it. I'm out. I'm not doing that. I'm not doing that. I'm not doing that. Aerobic exercise. It means you have to exercise. And by the way, these people weren't running marathons. It's nothing like that. Stress management training, meditation, don't smoke, and group psychosocial support. They talk things out, and they dramatically decrease their opportunity to have heart attacks or strokes. How much healthier do you think these people became? Yeah, a lot. So much they took them out of the cardiovascular, of the percentages. They took them out of the group that they said, oh, by the way, you do this, you don't even have this problem anymore. Can I ask you a question? Does it really seem like that's intensive lifestyle change? Well, you and I have known people who have had heart attacks and strokes. That's an intensive lifestyle change, not only for you, but for your whole family and your friends. Do you think you could go to a vegetarian diet? No, I'm not doing that. Nope. I like my fill in the program, whatever you want to do. Aerobic exercise. It means you go walk around the block and go for runs, bike, row, swim, meditate, don't smoke, and go through group psychosocial support. Go through some therapy. You talk things out. Is that really that intensive? To give you the opportunity to not have a stroke or heart attack. Conclusion: more regression of coronary occurred after 5 years than after 1 year. Of course, these people followed up and they said 1 year was pretty great. Let's keep on going. In contrast, in the control group, the people who went through typical or non-therapies, coronary atherosclerosis continued to progress, and more than twice as many cardiac events occurred. And then we get to intensive lifestyle changes may affect the progression of prostate cancer. So the first study was led by Dr. Dean Ornish, O-R-N-I-S-H. And this is done in, I don't know when this came out, 2005, the American Urological Association. So first of all, Ornish shows that he can reverse people's atherosclerosis or coronary artery disease. They can reverse coronary artery disease. And then he shows that we make some lifestyle changes, intensive lifestyle changes. Once again, intensive lifestyle changes, and you can affect the progression of prostate cancer. Ornish said, let me find out if this works for that, coronary artery disease. Let's see if it works on cancers. So first one he picked was prostate cancer. What'd they do? They went to a vegetarian diet, did aerobic exercise, stress management, which was meditation, and psychosocial group therapy. They did the same stuff, and then they changed prostate cancer. You ever had the feeling you're being lied to? They changed prostate cancer. They changed prostate cancer. I bring this up because Ornish then said, if this intensive lifestyle changes, by the way, they're not running marathons, they're exercising. Something in Empire Longevity is a foundation for you to be able to reach your more better years. What I find amazing about all of this is that we don't need to talk about this one supplement here, this one supplement there, that as if they are they're anti-aging. You know what's anti-aging? You being around for more years is anti-aging. How are you going to do that? First of all, dramatically decrease the opportunity to have the number one killer of Americans, coronary artery disease. Number two, decrease your opportunity for number two killer, cancers. Yes, this was on prostate cancer. And Ornish said then, if these intensive lifestyle changes works for that thing and works for this thing, how about we go after the big bad voodoo daddy, which is Alzheimer's? Ooh, this just came out a short time ago. A woman claims Alzheimer's symptoms were reversed after 5 years. In the last Alzheimer's patient, CNN chief medical correspondent follows Alzheimer's patient who says her symptoms have been reversed after participating in Dr. Dean Ornish's clinical trial on the effects of intensive lifestyle changes on the progression of mild cognitive impairment or early dementia due to Alzheimer's disease. Do I have your attention now? That peer-reviewed study will be published in the journal Alzheimer's Research and Therapy in June of 2024. This is May right now, so it's going to be next month. Dr. Ornish's program includes a plant-based diet, regular exercise, group support, yoga, or meditation. Watch the full documentary on CNN's The Whole Story, premiering May 19th. Plant-based diet, exercise, yoga, meditation, group support. 4 things, friends. Same shit I talk about in Empire Longevity all the time. My next step in Empire Longevity is we have to have a nervous system that's optimized so we can do that better. If we're going to help you be around for more years, we got to help you be around for more years. You know what the number one anti-aging therapy you could do is to be around for more years. Be so healthy that you have no choice but to be around for more years. The number one anti-aging drug you can take is to be around for more years. Plant-based, exercise, yoga, meditation, group therapy, talking stuff out, de-stressing, coronary artery disease, prostate cancer, dementia. Do we see a commonality in all this? Do we see a commonality of what we could do? And the answer is, of course, we see a commonality of what we can do. It's not that hard. And for the people who are going to tell me, yes, but I want to have I'm not hurting anybody. Follow Ornish up. Follow his studies. Read them. This is not that hard. When I go into a plant-based diet, the biggest problem I had was I didn't know how to cook foods enough. I didn't know how to do that. So what did I do? I went online and looked for recipes that are plant-based. I had to find more and more spices to eat. I learned how to recook. This isn't that hard. You know what's hard? Heart attacks and strokes are hard. Cancers are hard. Dementia is hard. This quote-unquote intensive lifestyle change, it ain't hard. It's not hard. Let's go do this. I'm Dr. Otto Janke. Thanks for being along today.